Imagine for a moment you're facing a, let's say, complex medical procedure.
Okay.
And back in your home country, maybe you're looking at just excruciatingly long waiting lists.
Uh-huh. Happens all the time.
Or perhaps the costs are simply, well, astronomical, just out of reach.
Right.
But what if there was an alternative? A place where you could access high-quality care, often more affordable, too, and maybe even recover in an environment that feels less like a sterile hospital.
And more like a retreat.
Exactly.
Yeah.
More like a rejuvenating retreat. Welcome to our deep dive into the Portugal Medical Treatment Visa.
Yeah.
Now, this isn't just any old entry permit. It's a specialized pathway. It's really designed for individuals like you seeking healthcare, specific treatments, or procedures in Portugal. So our mission today, really, is to give you a clear, concise guide to this visa. We want to reveal why Portugal has kind of emerged as this top spot for medical tourism.
It's quite a rise, actually.
It is. We'll cover everything.
Yeah.
Eligibility, applications,
Yeah.
the actual quality of care, practical stuff, making sure you're informed, but hopefully not overwhelmed.
Yeah, cut through the noise a bit.
Right. So let's unpack this. Portugal isn't just, famous for its beautiful coasts and cities anymore.
No, it's really building this reputation for world-class medical care.
It seems that way.
And what's truly fascinating here, I think, is how Portugal offers this unique combination. You've got modern medical facilities, really top-notch.
Okay.
You have internationally trained physicians, and often really competitive costs, especially when you compare it to other Western European countries or, say, the United States.
Big difference there sometimes.
Huge. And for many patients, those shorter waiting times, it's a massive draw. Sometimes it's the difference between getting care when you need it versus waiting, uncomfortably long.
That combination, quality and speed, it's definitely compelling. But, okay, beyond the obvious things like cost savings and shorter waits,
Yeah.
what else? What are some of the maybe less obvious advantages that really make Portugal stand out?
Well, if we connect this to the bigger picture, I think the real genius here isn't just the excellent clinical side.
Okay.
It's how they integrate the medical recovery with wellness, even a bit of tourism, you could say. So you've got the high-quality care, the modern facilities, the doctors who've trained globally.
Right, we covered that.
We touched on shorter waits. But crucially, beyond the purely medical aspect, Portugal offers this fantastic climate. It's just incredibly conducive to recovery.
I hadn't really thought about that part.
Yeah, imagine recuperating somewhere sunny, a favorable environment. It creates this unique chance to combine your medical treatment with a proper recuperative stay, maybe in one of Portugal's lovely tourist areas.
So it turns a potentially stressful medical thing into something else.
Exactly. An opportunity for real recovery, maybe even some personal discovery. And the visa itself supports this, the flexible duration, the possibility of extension if it's medically needed.
That's important.
Very.
Yeah.
And allowing someone to come with you, an accompanying person, that really helps with peace of mind, makes the whole thing feel less daunting.
That focus on the entire patient journey really resonates. Sounds like they're trying to ease the stress.
I think so, yeah.
So, okay, we've painted this promising picture of Portugal. The next crucial step for you, the listener, is understanding the exact visa paths available. How do you match your medical needs to the right entry permit? What are the main types?
Right. So Portugal offers two main visa types, basically catering to different lengths of stay needed for medical reasons.
Okay.
First up is the short stay medical visa. This is actually a Schengen C-type visa.
Well, the standard Schengen visa.
Exactly. For anyone unfamiliar, the Schengen zone lets you travel pretty freely between, 27 European countries once you're in.
Right.
The C-type is the standard short stay one. So this visa is for treatments or procedures that last up to 90 days. That's within any 180-day period.
Okay, 90 days max.
Right. It does allow multiple entries, which is handy, good for outpatient stuff, consultations, maybe short hospital stays. But the key thing is it cannot be extended beyond those 90 days within that 180-day window.
Got it. So what if you need longer, for more complex treatments or a longer recovery?
Then you'd be looking at the temporary stay visa for medical treatment. This one is specifically designed for treatments needing more than 90 days.
Okay, a longer-term option.
Exactly. It's valid for the expected duration of your treatment, up to 1 full year initially.
A whole year?
Yep. And like the short stay, it allows multiple entries during its validity. That's really helpful for, say, staggered therapies or maybe a long rehab program.
Makes sense.
And crucially, this one does have the possibility of extension if it's medically necessary.
That's the key difference then. Flexibility.
Huge flexibility. It's significant for patients who might face, unpredictable recovery times. So it's really suited for those complex procedures, extended therapy, or rehabilitation programs that just need more time.
Okay, that clarifies the two main routes.
And this naturally leads to the question, who actually qualifies? And for what kinds of medical needs?
Right, the nitty-gritty.
So first off, you have to be a non-EU, non-EEA, or non-Swiss citizen. That's baseline.
Okay.
And you specifically need medical treatment in Portugal. And this has to be confirmed by a Portuguese healthcare provider, officially.
Got it. A formal acceptance.
Precisely. Then you absolutely must demonstrate that you have the financial ability to cover all the treatment costs and your living expenses while you're there.
No relying on the Portuguese system for funds.
Nope. Comprehensive health insurance covering your stay is also mandatory. Plus, proof of your accommodation arrangements.
Where you'll be staying.
Exactly. And lastly, you need a clean criminal record. They usually check the last 5 years. And you must show a clear intention to leave Portugal after your treatment is done.
Unless you're applying for a different visa later, maybe.
Right, unless you have other plans approved. But the primary intent for this visa is temporary medical stay.
Makes sense. Keeps it focused.
Yeah.
Now, speaking of the medical needs, is this visa mainly for, big major surgeries, or does it cover a wider range? Maybe some things people wouldn't expect.
Oh, it's definitely a wide and quite diverse range. It goes way beyond just major surgeries.
Okay, like what?
Well, sure, it covers specialized surgeries and procedures, think hip replacements. We'll touch on a case like that later.
Right.
But it also extends to really critical areas like cancer treatments, including some very advanced therapies.
Okay, serious conditions.
Absolutely. Cardiovascular interventions, other orthopedic procedures, neurological treatments, various kinds of rehabilitation programs all included. And perhaps surprisingly for some, even extensive dental work, like full mouth reconstruction, that's covered too.
Dental. Interesting.
Yeah, and fertility treatments are another area. Beyond those, it can also be used for specialized diagnostics, maybe getting a second medical opinion from a Portuguese expert.
Okay.
And even, with the proper authorizations, of course, participating in clinical trials or certain experimental treatments. So it's quite broad.
It's much broader than I might have guessed.
Yeah.
Okay, so understanding the visa is one part. But what about the healthcare system itself you'd be using once you arrive? How does that work for someone on this medical visa, especially coming from outside the EU?
That's a great and really vital point to clarify. Portugal does have a public healthcare system, the SNS Serviço Nacional de Saúde.
Right, like the NHS in the UK.
Sort of, yeah. It's primarily for Portuguese citizens and legal residents. Now, generally speaking, it's not accessible to medical visa holders.
Except maybe in an absolute emergency.
Exactly, only in a true emergency. So your primary route as a medical tourist or someone on this treatment visa will definitely be the private healthcare section.
Okay, so you're looking at private hospitals, private clinics.
Precisely. And it's a pretty robust network. You've got private hospitals, clinics, specialists. They generally offer really modern facilities.
State of the art.
Often, yes. And importantly for international patients, particularly in the major institutions in cities like Lisbon and Porto, they frequently have multilingual staff.
That's a relief for many, I'm sure.
Definitely helps ease communication. English is very common in these settings.
So if someone's looking for really top-tier specialized care within that private system, where does Portugal particularly excel? What are its strengths?
Portugal's built a strong reputation in several key areas. They're highly regarded for cardiac surgery and interventional cardiology.
Heart procedures, okay.
Yep. Also, oncology treatments. Facilities like the Champalamud Clinical Center in Lisbon, for example, are world-renowned in cancer care.
I've heard of that one.
It's very well known. Other strong areas include orthopedic surgery, ophthalmology, eye care, dental procedures, and especially implantology.
Back at dental.
Yes, it's a big area. Reproductive medicine, so fertility treatments, plastic and reconstructive surgery, rehabilitation medicine is strong too, and neurological treatments.
Quite a list. And what about standards? How is it regulated?
The whole system, public and private, is well regulated. You've got the Ministry of Health, the Health Regulatory Authority, that's ERS, and the Medical Association, the Ordem dos Médicos.
So oversight is there.
Definitely. And crucially, many of these top private facilities also pursue and achieve international accreditations. Things like Joint Commission International, JCI.
JCI, what does that mean for a patient?
For our listeners, JCI accreditation basically means that hospital or clinic adheres to really rigorous global benchmarks for patient safety and quality of care. It's a strong assurance.
Like an international seal of approval?
Pretty much. You'll also see ISO certifications sometimes, which again reinforces those high standards so you can feel confident about the quality.
Okay, that's reassuring. Let's shift to the process itself. You need the visa, you found a potential provider. How does the application journey actually work, step by step?
Right. The process might seem a bit thorough, and well, it is, but it's clearly defined. It's designed to make sure genuine medical needs are being met and that your stay is properly supported.
Makes sense. Where does it start?
It really starts with step 1, medical arrangements. This is foundational. First, you need to identify a specific treatment provider in Portugal, a hospital or clinic.
Research time.
Yes. Then, arrange an initial consultation. This might be virtual, or maybe by sending over your existing medical records for them to review.
Right.
Then, the crucial part. You need to get a formal written confirmation of acceptance for treatment from that Portuguese medical facility.
The official, yes, we'll treat you letter.
Exactly. And this letter should also include detailed estimates of the treatment costs, outline their payment procedures, and ideally establish a preliminary treatment timeline so you know what to expect.
So securing those initial medical arrangements really sets the stage for everything else. It sounds critical.
Absolute foundational, yes. Once you have that acceptance and the plan,
Then what? Documents.
then comes step 2, preparing documentation. And yeah, there's quite a bit here. You gather all your required personal documents first.
Right.
Your valid passport, obviously. The visa application form itself, completed. Recent passport-style photos. Proof of your legal residence in your home country. A criminal record certificate, usually for the past 5 years. Travel insurance.
We'll come back to insurance details later, I bet.
Definitely. And an authorization form allowing Portuguese authorities to check your criminal record there, too.
Okay, that's the personal stuff. What about medical docs?
On the medical side, you'll need a detailed medical report from your own doctor back home. That confirmation letter we just talked about from the Portuguese facility, your treatment plan with the estimated duration, any appointment confirmations, proof if you've already made an initial payment or deposit, and of course, all your relevant medical history and test results.
Comprehensive.
Yeah.
And financial proof.
Yes, you need proof you can cover all the estimated medical expenses. So you'll need that cost estimate from the facility again. Evidence of how you'll pay bank statements, insurance coverage confirmation, etc. Proof you have funds for your living expenses to food, transport, daily life, and proof of your accommodation arrangements.
Okay, and a really crucial detail you mentioned earlier.
Yes. Anything that isn't originally in Portuguese, which will be most things for many applicants, must be translated by a certified translator.
Certified, not just any translation.
Correct. And then those documents, both original and translation sometimes, need to be apostilled or legalized.
Which is like an official international stamp.
Exactly. It authenticates the document for use abroad. It's essential. And quickly, if someone is accompanying you, like a family member,
Right, the support person.
they'll need their own set of documents.
Mm-hmm.
And proof of the relationship, a statement explaining why they're accompanying you, proof of their own financial means and accommodation, and their return travel plans.
Okay, that's quite the checklist. Meticulous preparation needed.
It is, but it's manageable if you're organized.
Once all those documents are finally gathered, translated, apostilled, what's the actual submission process like? Where do you go?
Okay, with all that vital paperwork in hand, you move to step 3, submitting your visa application.
A formal application.
Right. You'll need to schedule an appointment. This is usually done at the Portuguese consulate or embassy in your country of residence.
Not in Portugal itself.
No, you apply from home before you travel. At the appointment, you submit all that documentation you meticulously gathered.
Okay.
You pay the application fee. Currently, that's typically around €90.
Seems reasonable.
Yeah. Then you'll likely provide biometric data fingerprints and a photo. And usually you'll have a brief interview. They might ask about your medical needs, your plans in Portugal, just to verify things.
Makes sense. And then the waiting game. How long does it usually take to get a decision?
That brings us to step 4, visa processing. Typically, it ranges from about 15 to 30 days.
Well, that's not too bad, actually.
No, it's generally quite efficient. And importantly, there is potential for expedited processing in truly urgent medical cases. They understand that sometimes speed is critical.
Good to know. Assuming it's approved, that's
Well,
next. Packing bags.
Pretty much. Once approved, you move into step 5, travel preparation. This involves confirming all your medical appointments back in Portugal, booking your travel, and you need to think carefully about your medical condition when booking flights, maybe needing assistance,
Right. Practicalities.
finalizing your accommodation, arranging any remaining payments with the hospital or clinic, and, really important, organizing your complete medical history to bring with you. Don't rely on just what you sent before, bring everything.
Good tip. And finally, the arrival in Portugal itself.
Yes. Step 6, arrival in Portugal. When you land, you'll go through immigration, obviously. Then check in with your medical facility as planned. Get settled into your accommodation. Maybe do a little local orientation. Find the nearest pharmacy, grocery store. And make sure you have all necessary emergency contacts set up.
Okay. And one more thing you mentioned. What if the treatment takes longer than expected? The extension.
Right, the visa extension for ongoing treatment. This is a really important safety net. If your treatment requires a longer stay than your initial visa allows,
Which can happen with complex conditions.
absolutely. You'll need to get an updated medical report from your Portuguese doctor confirming the continued need for treatment there, an updated treatment plan, renewed proof of your financial means to cover the extra time, proof of valid health insurance for the extension period, and proof of accommodation.
Similar documents again, but updated.
Essentially, yes. You then schedule an appointment with EMA, that's the Agency for Integration, Migration, and Asylum, the immigration authority in Portugal. You submit the documents, pay a small extension fee, usually around $30.50.
And that gives patients crucial peace of mind, knowing there's a process if things take longer.
Exactly. It removes a significant layer of stress.
Okay, we've walked through the whole journey visa-wise. Now let's dive into the practical side people really worry about. Money and logistics. What are the financial bits listeners need to factor in? And how does insurance really fit into paying for the actual treatment? Any common pitfalls?
Right. Financial planning is absolutely key here. Let's break down the costs. First, the visa and administrative costs. We mentioned the visa fee itself, around €90. A potential extension fee, maybe €30.50.
Okay.
But then you have costs for a document translation. That could be €15-30 per page, maybe more for complex stuff. Legalization or getting an apostille, that can run anywhere from €20 to €100 per document, depending on your country.
So those admin costs can add up.
They can. And translating a detailed medical report could be $50, $150, for instance. So budget for that prep work.
Okay. Now, the big one,
Yeah.
the actual medical treatment costs. What kind of range are we talking about? I know it varies hugely.
It does vary massively, depending on the specific procedure, the facility, the city. But just to give a rough idea, consultations might be $80 to $200. Diagnostic tests like scans or complex blood work, maybe €100 up to $2,000 or more. Major surgeries, hip replacement, cardiac surgery could range from $5,000 to $30,000, perhaps even higher for very complex cases.
Right.
Specialized treatments like certain cancer therapies might start around $10,000 and go up to $50,000 or significantly more, depending on the duration and drugs involved.
Wow. And you mentioned deposits.
Yes, it's very common for private facilities, especially for major procedures, to require a significant deposit or even full prepayment before treatment begins.
Yeah.
You need to be prepared for that cash flow.
Okay. Beyond the medical bills, what about just living there? Daily life costs.
Right. Living expenses. You need to budget realistically.
Yeah.
Accommodation, hotels might be $50, $200 a year hope per night. Renting an apartment, maybe $600, $2,000 per month. Very dependent on location and size.
Cheaper outside Lisbon and Porto, presumably?
Generally, yes. Meals, budget maybe $30,000, $60,000 per day if you're eating out sometimes, less if you cook. Local transportation, $520 per day using public transport or occasional taxis. And how do you pay for all this?
Payment methods, right?
Yeah. For the big medical bills, Portuguese facilities usually accept international bank transfers. Major credit cards like Visa and MasterCard are widely accepted.
Good.
Sometimes, if you have good international health insurance, they might arrange direct billing, but you absolutely need pre-approval for that. Don't just assume it works.
Okay. Pre-approval is key for insurance billing.
Vital. Cash is really only for small day-to-day expenses, not for settling large medical bills.
Got it. Now let's circle back properly to insurance. It sounds like there are different requirements. Can you clarify again what's needed just for the visa application versus what you need to actually cover the plan's treatment?
Yes, this is a super crucial distinction, and people often get confused. For the visa application itself, you absolutely must have travel insurance.
Standard travel insurance.
Yes, but it needs to meet specific Schengen requirements. Minimum coverage of €30,000 for emergency medical expenses, and it must include repatriation coverage, getting you home if needed medically. This covers you for your initial stay duration for unexpected emergencies.
Okay, so that's just to get the visa approved and cover unforeseen issues upon arrival.
Exactly. It is completely separate from how you will actually pay for the planned medical treatment you're going there for.
Right. So how do people cover the planned treatment costs?
That could be through several ways. Maybe your existing comprehensive international health insurance plan covers treatments abroad again, check policy details, and get pre-approval. Or you might buy specialized medical tourism insurance designed for this purpose. Or, quite commonly, people self-fund through direct payment.
Okay, so travel insurance for the visa, something else entirely, or self-funding for the actual procedure. Big difference.
Huge difference. Now, thinking about practicalities. Accommodation options. Beyond just hotels or apartments, you might consider hospital inpatient rooms for immediate post-op care,
Right.
or even specialized medical recovery facilities, which are designed for recuperation. When choosing, think about key things. Proximity to your medical facility. How easy is it to get to appointments?
Accessibility features.
Crucial. Do you need ramps, walk-in showers, transportation availability nearby? Dietary needs, can they be accommodated? And space, especially if you have an accompanying caregiver.
Lots to consider there. And getting around. Transportation and mobility.
From the airport, you might need prearranged medical transport if your mobility is limited. Accessible taxis are often available. Private transfers are another option. For local travel, getting to appointments, some hospitals offer shuttles. Otherwise, pre-booked medical transport or regular taxis ride shares.
Okay. Last practical point. Language and communication. Big worry for some.
Understandably. But in the major private hospitals, you'll find multilingual staff is quite common. English is widely spoken, often Spanish and French too.
That helps.
Professional medical interpreters can also be arranged if needed, usually through the hospital. But it's always a good idea, I think, to learn a few basic medical phrases in Portuguese.
Please, thank you, pain doctor.
Exactly. And definitely have your key medical documents translated into Portuguese beforehand. It just smooths the process.
Good advice. Okay, moving beyond the core procedure and logistics, you mentioned Portugal being good for recovery. Tell us more about that aspect. What about special programs?
Right. It's often not just about the specific operation or treatment. Portugal and its healthcare providers really think about the whole recovery journey. Many facilities offer special medical programs.
Like package deals?
Sort of, yeah. Comprehensive medical tourism packages that bundle everything together. The pre-admission stuff, the treatment itself, post-procedure care, maybe even accommodation and local transport. It just streamlines the whole experience for the patient.
Take some of the planning burden off them.
Exactly. And beyond packages, there are specialized treatment programs where Portugal has really developed specific expertise.
We mentioned some areas earlier.
We did. Think about dedicated rehabilitation programs for stroke recovery, post-surgery rehab, cardiac rehab. They're very strong there.
Okay.
There's also a growing focus on wellness and preventive medicine. Things like executive health checkups, detox programs, weight management retreats, often combined with a nice environment.
A health MOT and a nice climate.
Pretty much. And of course, those specialized clinics are prominent. Advanced dental work, fertility treatments, plastic surgery centers, dedicated pain management clinics. They often have very focused programs.
So lots of options depending on your needs. What about after the main treatment is done? Post-treatment considerations.
This is vital for good long-term outcomes. It includes scheduling any necessary follow-up care, whether in Portugal or back home, getting detailed treatment reports and discharge summaries to give to your doctors back home.
Communication between doctors is key.
Absolutely. Managing medications, understanding what you need, dosages, how to get refills, coordinating care with your home physicians is critical for continuity. And some Portuguese providers even offer telemedicine options for remote check-ins after you've left.
That's useful. And the recovery environments themselves.
That's a huge plus for Portugal. You've got coastal regions, the Algarve, the Silver Coast, where the climate is just fantastic for gentle recovery.
Sea air and sunshine.
Exactly. There are also thermal spa towns, like Caldas de Rainha or Chaves, using natural mineral waters for therapeutic purposes, and dedicated recovery retreats or medical hotels that are specifically designed and staffed for post-procedure guests.
So you can choose an environment that really suits your recovery style.
Precisely. It supports healing in a much broader sense.
Okay, this all sounds great in theory. But for our listeners who might be seriously considering this, what are some top practical tips? Just quick hits for ensuring success throughout the whole process, from planning to coming home.
Okay, quick tips pre-departure. Get hyper-organized with your medical records. Create a single file, digital and maybe physical, with everything. Plan your medications, bring enough for your initial stay, plus some buffer with prescriptions. Do a little cultural briefing, learn basic Portuguese phrases, figure out your phone communication setup.
Preparation is key during the treatment.
During treatment, keep a communication log. Note down dates, who you spoke to, key decisions made. Helps keep track. Lean on your support system, whether it's an accompanying person or virtual check-ins from home. And know your emergency protocols, hospital number, local emergency number, your embassy contact. Document your progress if you can.
Stay proactive. And after treatment, heading home.
Post-treatment, focus on continuity planning. Make sure you have all necessary medical documents, clear post-op instructions, medication lists before you leave. Share these promptly with your home doctor. And, critically, don't rush the return journey. Factor in adequate recovery time before undertaking long-distance travel, especially flying. Give your body time.
Solid advice. Now, to really illustrate the impact, let's look at some real-world examples. These stories can bring it all to life. Take orthopedic surgery.
Yeah.
We heard about a Canadian patient. They were facing a potential 2-year waiting list for a hip replacement back home.
2 years.
Wow. Yeah. Through this Portugal Medical Treatment Visa, they managed to get the surgery in Lisbon within just 3 weeks.
Incredible difference.
And after the procedure, they didn't recover in a gloomy hospital ward. They went to an Algarve resort, enjoyed the climate, and the cost. Saved approximately 40% compared to private options they were looking at in North America.
So, faster, better recovery environment and significant savings. That's compelling.
Exactly. It highlights speed, value, and quality of experience. Or how about cancer treatment?
Okay.
A patient from the Middle East needed advanced cancer therapy, something not easily available where they lived. They accessed treatment at Lisbon's Champalimod Center, that world-renowned place.
Right.
And the medical visa wasn't just for the patient. It allowed multiple family members to come along and provide crucial emotional, logistical support during what was a tough 6-month treatment program.
That shows a flexibility for accompanying persons, which is so important for serious illnesses.
Definitely. Another fascinating one, dental reconstruction?
The dental again.
Yes. A U.S. patient needed extensive work. They combined it with a 3-month stay in Porto. Because the treatment was staged, had different phases.
Right, not all done at once.
Exactly. It allowed them time between appointments to actually explore northern Portugal.
Yeah.
So it turned this necessary, maybe daunting medical procedure into both a health success and a really rich cultural experience.
Yeah.
And all at a fraction of what it would have cost back in the U.S.
That's integrating treatment and travel perfectly.
It really is. And one more, fertility treatment.
Okay.
An Asian couple chose a specialized clinic in Lisbon. The medical visa was key here because it allowed them flexible, multiple visits over the course of a year, fitting around their treatment cycles without constant visa applications and stress.
That takes away a huge administrative burden during an already stressful time.
Totally. And the cost savings they found, compared to similar treatments in other European countries they'd researched, were so significant, they basically covered all their accommodation and travel costs for those multiple trips.
Wow. So these stories, they really underline something, don't they? Beyond just the medical outcome, which is obviously paramount. How do they illustrate these broader benefits? You know, integrating healthcare with maybe a new cultural experience, a supportive environment. It's not just about fixing a health issue, is it?
No, it seems like it can be more transformative than that. Perhaps changing your perspective on the whole healing process.
Yeah, maybe finding wellness in a broader sense.
So as we wrap up here, recapping, it seems pretty clear the Portugal Medical Treatment Visa provides this really well-structured pathway. It opens doors to quality healthcare, often in a beautiful setting, and frequently at a more affordable price point within Europe. Portugal's unique mix the medical excellence, the natural beauty, that favorable climate we talked about, the competitive costs. It really does position it as, well, quite an exceptional destination for medical tourism today.
It certainly seems that way.
Yeah.
Strong package.
So, a final thought for you, our listener. Considering all of this, beyond just seeking medical care, which is the primary goal, how might choosing a destination like Portugal for your treatment actually transform the entire experience? Imagine integrating healing, not just with the necessary medical procedures, but maybe with some personal discovery, a richer quality of life, even during your recovery period. What new dimensions of wellness, perhaps, could that kind of approach unlock for you? Something to think about.